Do you think we've got everybody in that we're expecting in? Seem to be there, so okay, thanks everybody. Say welcome to today's meeting of the SCP. We're still getting people coming in. So.
Not mentioned it, actually.
Okay, hopefully that's us. Everything's coming in now. Okay, first of all, check Emma if you're online for a minute now.
Emma's asked that the recording be sent to her so she can minute it after the.
That's just coming in from that. Okay, yeah. That's fine. Okay, thanks everybody. Thanks for your time and joining so sharply. Fiona, are you aware of any apologies for today's meeting?
Yeah, I do have a few. I'll just run through them. Maybe 1 minute. Apologies from Angela Simpson, Scott McDonald, Karina Ross, Denise McDonald, Joan Mackay, Eve Scott, Audrey Parsons, and Jacqueline Barkley.
Okay, that's great. Thank you for that. So moving on to agenda item 2, the minutes of last meeting, which were circulated with the meeting invite. I'll say give everybody an opportunity to read them. What I'll do is I will just go through page by page if there's any amendments anybody wishes made to them. So first of all, page 1.
So could I add my name to the list of attendees? I'm not there. I was at it.
Okay, no problem. Fiona?
Yeah, it was just there was a item under item 2 about the transport for tongue. It says that there's a bit of confusion about the licenses that were used for transport for tongue. That bus passes cannot be used under the section 22 licence. Students going to college do get the transport paid. It's apprenticeship that don't. I just wondered if this is the wrong way round. Because those that are on apprenticeship get their travel reimbursed under the Skills Development Scotland, and students for the college, their bus passes, they don't get reimbursed under the Transport for Tongue because it's a community bus, so they can't use their bus passes, but they can get their travel reimbursed through the college as long as their parents' income comes underneath the threshold. So if their parents' income is above the threshold, the parents are expected to pay for the travel.
Okay, that's why we can get that clarified in the updated version of the minutes. Anybody else got anything for page 2? Page 3? Page 4? Page 5? Page 6? Page 7? Page 8? Page 9? Page 10? And lastly, page 11. Okay, so obviously there's some minor amendments to be made there, which can be done to the final version, but other than that, no other amendments to the minutes, which takes us on to agenda item number 3, which is the NHS Sutherland District Plan, and that's going to be presented by Fiona Thomas.
Hello. Bear with for a minute and I'll share my screen and hopefully you'll all be able to see it if my technology works for me today. Or not. There we go. Now I can't see anything, so I don't know what you can see.
Yeah, we're seeing your PowerPoint presentation.
Oh, you are, lovely, okay. Fab. So, the Highland Health and Social Care Partnership have released their strategic plan for 2024 to 27. And as part of that, all districts have been asked to put together a district plan and set up district planning groups. One of the conversations we had very early on was whether they should actually form part of this group, but we were asked to have a separate group. I think perhaps moving forward that might change, but we'll have to see. So we have a district plan which supports our approach to the co-production, and look, the purpose of it is that we focus on what our need is in Sutherland specifically. We'll look at how we will implement the joint strategic plan, how we'll respond to local needs and issues within the district, and how we better align with the overarching joint strategic plan. So this is all being done in compliance with the Scottish Government's localities guidance, and it's based on what do we know about health and social care needs, the demands in our district, what our current performance is against key targets, resources that we have available, which will include staffing, finance, accommodation. Now, the purpose of the district planning group, we've had one meeting so far, and they are to be held quarterly. But basically, it provides a forum for professionals, communities, individuals to develop and deliver a locality plan for Sutherland. The idea is that we'll look at how we can identify what our priorities are, and basically we need to make sure that we're engaging across the board, and I think that's potentially something that has been lacking in the past from our perspective. The core members, so members of the community, carers, health and social care staff, third sector and independent sector, and we can have additional members, elected community councillors, primary care, lots of other things, and we may decide as a group that we'll need to co-opt people in, and we'll do that as well. I'd just say at the moment that we have got quite a few members, but we are lacking in carer representation, third sector and independent sector. We could do with bumping up. So if you know anyone, any suggestions, or if you'd like to join the group, I promise I won't make you do loads of work, but it will be really worthwhile. So if you can think of anything, just please do let me know. The group will develop the Sutherland District Action Plan. And that's basically just the areas of work that we will want to focus on, and that will be in development over the next few months. But in effect, it's about supporting people to live fulfilling lives in their own homes for as long as possible. Health and well-being promotion, helping to support our staff, and to manage all of the resources that we have, to deliver the best value. This is just to let you know where it kind of sits within the organisations. So you'll see we've got NHS, Highland Council, we've got the Joint Monitoring Committee, Partnership Board, and you can see where the district planning groups sit in that governance structure. Now, the Adult Services Strategic Plan sets out the vision for the partnership over the next 3 years. It's been written with unprecedented demand and complexity at the forefront. We're at a time where people's needs are becoming much more complex, and we've seen an increase in demand for services, and obviously we have significant financial pressures. So how do we get the services that we need for our communities? We need to put in support as close to home as we can. That's something I see on an almost daily basis, is people being away from their homes, which makes it incredibly difficult, not just for them, but for the people around them. The need for transformation. We need to improve the quality and experience of the care that we provide. We need to look at utilising advancing technology that may be available to us. Obviously, we need to spend our money in the most efficient and valuable way, but I think for me personally, it's the focus on ensuring that people can stay at home for as long as possible, and for our staff to be able to provide the best care they can. We're very thinly spread, and we are having, in Sutherland in particular, real difficulties in recruiting. So we need to find a way of improving that. Creative suggestions will be much appreciated. There was an engagement process, and this included an open survey, and I think I'm not overly keen on this slide. It's not mine, so I'll just be open with that at the beginning. But there were some online discussions, there was social media, and it was fairly well, it was widely circulated, and there were quite a lot of suggestions that came back, which were then put back into the plan following review. To deliver it, we need to think about any service or proposal that we make. Does it deliver effective, efficient and equitable plan based on evidence, benchmarking, best practice? Is it affordable, and can we safely and sustainably staff it? That being a huge key part. So the services that are involved or that will come under the plan are older adults, including those in a care home, adults with a learning disability, adults with a physical disability or illness, adults with mental health conditions, people living at home with long-term conditions, and adults requiring drug and alcohol recovery support. The vision of the strategic plan is that we'll work with people to plan and arrange their care and support. that we help everyone to live a healthy, active life. We transform the way we deliver our services. We need to work with unpaid carers to ensure their health and well-being is looked after. And we need to encourage and enable community organisations to thrive. So this is all about co-production and co-delivery of services within our communities. We need to reduce inequality, ill health and dependence. We should be doing now, and we definitely need to be doing in the future, putting that person, the individual, at the centre of everything. Our care needs to be quality focused. We need to respect people's choice and independence. Like I said before, we need to deliver support as close to home as we possibly can, or at home. And we need to build our workforce. We need to build resilience in our workforce. So what the plan means for individuals and communities is that we're looking at home first and last. Independence, living an ordinary life, a real focus on supporting unpaid carers, and ensuring that we are really looking after our unpaid carers, providing respite, palliative care options, and we'll work with carers organisations to see what else we can do to provide that support. We need our communities working together, building that local resilience and access to good quality support and services when they're needed, ensuring that people's health and well-being is good, and signposting to agencies and care services as appropriate. And lastly, with residential and nursing homes, we need to ensure that the settings are appropriate for our needs. We have an ageing population, we know that, and we need to really put a good focus on ensuring that we've got what we need in our district. So we need to make quite a lot of changes, and the main changes will be a focus on prevention and early intervention, with the aim of trying to prevent things happening before it all goes wrong, and then all services have to leap in and help. Empowerment of choice and independence, straightforward access to services. I'm aware that is not something that we have at the moment. Being relatively new to Highland, it's eye-watering how complicated it is. So we're really looking to make that as easy as possible. Maximising the use of technology. As I said before, developing our workforce. We need to be able to have services that can respond in an urgent situation as quickly as possible. We're looking at a different delivery of services that would perhaps traditionally have been delivered in acute hospitals, and that speaks to bringing things back into communities, and giving our services the ability to put in an immediate care option that could prevent a hospital admission or bring someone out of an acute hospital much quicker than we're achieving at the moment. So obviously, lots of working together. We need to work collaboratively with all of you, all of our local communities, our third sector partners, independent providers. We need to use the existing forums we have, and work together to develop and implement these local delivery plans. There are a number of codependent strategies, which I've listed there. There are actually a few more, I think, but those are the main ones, I believe. And that's me saying thank you. And I'm going to stop sharing for a minute. Hang on a minute. There I am. So that's the corporate and overarching strategy. The Sutherland District Planning Group will be, or is chaired by Michelle Johnston, who is our area manager. We've had one meeting, as I said. We'd very much like to increase our membership. So if you're interested, give me a shout. Apart from all of the strategy, my reflection on having been here since October last year is too complicated, and we need to make that easier for our communities, the people who need to access our services, but also for you guys. And almost daily, probably at the moment, I encounter something where I think if it's that hard for me to find out, then it must be horrendous for somebody who has no experience of navigating the NHS and adult social care. And I think we need to make that better. We are obviously financially challenged, and that is always really, really difficult to navigate. We have to balance the finances with the care that we want to provide. From my perspective, and I know from the teams that I'm responsible for, we are fully focused on making sure that we've got skilled and really, really excellent quality care that we can provide to people. And we're going to have to be a bit creative, which is good, which is fine. My big focus at the moment is the north and the west of Sutherland, because they're not, neglected is the wrong word, but I can't think of the right word at the moment. But it's tough. It's really tough when we're providing services. So I'm really looking at how we can strengthen that significantly over the next few months. So I hope I haven't bored you all to death. And thank you very much for listening. And if you want to join us, let me know. And if you've got any questions, let me know as well. Thank you. Harry.
Hello,
I
how
knew
are
you'd
you?
ask a question.
For those who are not aware, I'm Harry Tetson, Community Engagement Officer with Highland Hospice, and I had the delight of attending a meeting in Durness with Fiona and the team, and I think Marion was there last week, where the challenges, I could put it like that, for the North and West Sutherland for delivering any of this strategy were completely overwhelming, even to somebody like me. The two things I just like to bring up to this meeting, because there's clearly a period of transition that we're going through. We have no more money. We all know that, and the communities are going to have to do it for themselves. The local authority to Highland Council have held back £20 million from their budget for what they're referring to transformational change, and are waiting for the NHS to come up with a policy of what transformational change should be. Now, the stuff that Fiona has just put in there is aspirational, but Fiona, two things strike me. One is there a benchmark for both finances and services to what we've got now? Because I haven't seen that. Two, you mentioned a lot about co-production, but there is nothing about co-design. And that's the important part. I think if you're going to get communities to work collaboratively with the things, then that £20 million could be allocated to communities and community hubs to develop their resources, to link in, to provide that community-led social care resilience, which is what I think you are trying to achieve. Do you have any comments? Hello.
Well, right on the spot now. As for the 20 million, I would need to go away and find out. Co-design, absolutely. I think we, in the NHS and in adult social care across the board, not just here, across the whole country, we're really, really good at doing things to people and then asking them to join us. So certainly for me in Sutherland, we need to work and we need to design this with the people that are actually going to be using our services. Our meeting last week for me was really, really helpful. And we've got great and very resilient communities. And these are the people we need to get to and say, what do you need? And how are we going to do it? Because it's not easy and there isn't any more money. And that's a painful reality for us at the moment, which is where the creativity comes in. Does that partially answer it?
I think it partially answers it. I think the benchmarking is the other point. For those that are in the meeting who weren't at Durness, provision of care at home, so with the whole thing that Fiona just presented was providing care at home. Unmet need for May for the whole of Sutherland was seen to be 14 hours per week. Need is only created as a stat once an assessment has been done. And there is nothing, so many times that people were waiting for assessments right, left and centre to be done. And even to the extent that one woman who rang on behalf of a neighbour from Kinloch Burvey was told by the social worker that they were, quote, geographically challenged, the implication being that there was no point in doing an assessment to get you a bus ticket for social care because social care was never going to be able to be offered in the area because there was a lack of a service. And the community were asked in the meeting to look at suggestions as to how they could help. And it came to paying for, potentially through option one, for personal assistance, which are not regulated in any shape, way or form, cost more than the council pay for personal care, but are local. But there is no mechanism or framework to support them and to support the carer to make sure that they're there. Now, if that's quality service that's being promoted by the NHS, that's fine, but I just think there needs to be a transparency about that. Clearly, the Brogan, who's the support worker in Tongue, is an excellent person and is fully cared for, but because there is no regulation of personal assistance, I wonder whether that's a line you want to go down. Bearing in mind you've got Brora and Helmsdale, I think, within the Sutherland community and that east coast, I cannot see how there is only 14 hours a week of unmet need in the whole of the Sutherland area. And I would ask this committee to check those figures and to check how long you are waiting for an assessment to take place. It would also be helpful to know how many social workers are employed in the Sutherland area to do those assessments. So, thank you.
Thanks, Harry. And just to let you know that I have very recently commissioned a review of our care at home service. So part of that will be, at the moment, the number crunching is going on with regard to unmet need. I think you're absolutely right. It's, some might say, convenient that that's how the figures are, you know, got to. But we are looking at all of that. We're looking at how we can really increase in the north and west, but that's our area of the most significant gaps that we have. That's around staffing more than anything else. So we're working to do that, and I'm hopeful that this ongoing project will enable us to deliver differently. As far as the personal assistance, yeah, I'm still thinking about that. There are pros and cons. Brogan was amazing. If everybody was like that, then we're all good. But we realistically, they may not be. So yes, and I'll be happy to feedback at any point, and you can come and join our meeting. Michael.
Let's go to Michael next, please.
Yes, hi. I was also at the meeting at Durness. So a couple of things for you. I'm always interested, as you well know, about what is happening at Migdale. I think you told us that you have, I think, 3 beds now in the ward that was pretty well shut down since COVID 2020. Is there any likelihood of some more of those beds being taken on board?
Not at the moment, and actually, so we opened up some additional beds at Migdale on Strathy ward because there was an issue with one of the wards at Raidmore.
Yes.
And that ward had to be closed quickly for fire compliance work, and we were asked to take patients. There weren't any Sutherland patients in that cohort on that ward.
Right.
So we opened up, and we're actually now, we were at 15 beds. Obviously, normally we're at 12. We're now at 13. And next week we'll be back down to 12. And we'll remain at that. However, I have asked what the long-term plan is. So we are currently looking at what the long-term plan is for Strathy. Because we've got it sitting there empty.
Yes, exactly.
The issue that we had, Michael, was that it was incredibly difficult to staff the additional beds.
Yes,
and that took quite a long time.
Yeah. Now, the other thing, I wondered if in your diary you would be available for a presentation to the Creek Community Council on Monday, the 17th of this June.
Of course.
Well, I think the Community Council would be pleased to have an input. We did have from your previous incumbent, Kate, Kate Kemure, was very pleased to go around the community councils and just give them a wee update. We would be very pleased if you could come. Yes.
Just pop me the invitation, Michael. Just let me know when and where, and I'll come along. I'm happy to attend any of the community councils.
That would be really, really helpful. Yeah. Lovely. Thank you. Good, good.
That's great. Thanks. Is that all your questions, Councillor Baird?
Yes, indeed, Richard. Thank you very much.
That's great. Thanks. Can we go to Anna next?
Hi, thanks very much, Anna Parkfield, Ardguy Hall and Planet Sutherland. I attended a green health workshop in Lerg along with Fiona. A couple of weeks ago, there was 2 different workshops. So that was looking at prevention through green health. It was run by Ailsa Villegas from the Health Improvement Specialist Public Health team. So I was wondering, given the link between green health, think nature, and all of the benefits of that, whether there's any link up with your plans to work with them. Thanks very much.
I would very much like to, yes. So if you can let me know who to contact, and if it's you, I've got the name now. But yeah, absolutely, definitely.
Okay, thanks very much.
Thanks. Is there any further questions for Fiona? No, if not, Fiona, thank you for your input today. It's interesting, also generated a few questions, so that's ideal. We'll move on in the agenda, and the next is an input from myself in relation to emergency liaison groups, and I'll try and share my screen. Okay, as I can't see, can you tell me if they can see the presentation?
It's there,
Yep,
Richard.
we're
Yeah.
seeing that.
It's there. Perfect. Okay, so this is a request that came from the Highlands and Islands Resilience Partnership to brief all community partnerships on the ELG, the emergency liaison groups, and their role. Bob Wells says this presentation has been designed Highland-wide. The examples it gives are not local, but I will give more localized examples of where we've been used. So for the ELGs, there's a number of ELGs in the Highland area. We're actually unique in Scotland. In terms of local authority areas, they've got a responsibility to have resilience partnerships, and they are normally at council level, which we have. But due to our geography, it's then broken down further to have emergency liaison groups for certain areas. So the one that's relevant to yourself is the Caithness and Sutherland emergency liaison group, which is chaired by Inspector Steve Mezzles from Caithness. Also, that's part of North Island Policing Command area. So the other one that's chaired is the Ross and Cromery, which covers the south part of our command area, and that's chaired by myself. So as we've got 7 ELGs throughout the Highland area. Let's say the one that's relevant to yourself is Caithness and Sutherland. So this comes from the Civil Contingencies Act 2004, which outlines responsibilities for certain categories of responders in relation to major incidents or significant incidents. So category 1 responders are local authority, the Blue Light Services, Health Board, SEPA, and the Coast Guard Agency. And then category 2 responders are like utilities, transport, NHS, Scotland, Health and Safety Exec, and the Met Office. Although there is a move to get the Met Office changed to a Cat 1 responder. So in terms of the Cat 1 have a legal duty to respond, and Cat 2 responders have a duty to cooperate with Cat 1 responders in major incidents. So what is a resilience partnership? It's basically a multi-agency meeting that sits at a tactical level to support the operational response to an incident. This is done under what's known as the JESIP principles, which are used by all emergency services in response to major or significant incidences. And that is to collocate, communicate, coordinate, to jointly understand risk and have a shared situational awareness. So the partnership will meet, share information and coordinate the actions to respond to an incident. The information sharing will allow organisations to have a shared situational awareness and as they create a joint action plan to respond to it. It also ensures that we effective use of resources across agencies, so that we will share resources to ensure that things are dealt with. For emergency liaison groups, they've actually got two phases. They've actually got three phases, sorry. One is planning, then response and recovery. So as an ELG is basically a resilience partnership covering a smaller geographical area, for example, Caithness and Sutherland, compared to what other areas, for example, Grampian, that just has one for the whole of Grampian. It's the police's responsibility under the Civil Contingencies Act to coordinate the response to an incident. And we are the coordinate agency, but may not be the lead agency. For example, wildfires, it would naturally sit with fire service, but we will always be the agency that coordinate the multi-agency response. As an incident moves from response to recovery, so does the coordination of it, then moves from the police to the local authority, who are the coordinate agency for recovery phases of an incident. In terms of why a resilience be called, so a resilience partnership can be requested by any CAT 1 or CAT 2 agency. And in general terms, the meetings, it's basically a virtual table. They're normally done by Microsoft Teams, so that we can meet in quick time when an incident has occurred to get that joint situational awareness. That then also brings in other structures, the likes of Care for People, which is led by NHS, which feeds into the resilience partnership, and again provides shared awareness, but also so we can respond to people who need additional care where there's challenges in delivering that. As I said, the scenario I'm going to give you is based on another area, but I will give you more localized scenarios. So the one that's given in the slides is a landslip on the high road into Kinloch-Leven, caused all traffic into the area to travel along the low road, which is not suitable for heavy traffic and is popular with visitors. Concerns were raised if an arch seems to occur on the low road. This would lead to the community being cut off and would restrict access to emergency services. So obviously potential significant consequences for the community and the blue light services. An ELG was called to discuss, was chaired by the police. No one agency had all the answers and how we were going to deal with it. So the concerns were voiced by partners. It was quickly established that the Coast Guard and Lifeboat had pre-identified landing points that could be used to get people in and out. So there's contingency plans in place. There was pre-identified landing points for air ambulance, and the Scottish Ambulance Service had a vehicle in Kinloch-Leven that can be used to transport patients to ongoing transport. And there was retained fire appliances in Kinloch-Leven itself. Highland Council road planners attended, and then they also undertook to clear one lane of the road to ensure that we could get traffic lights in place, kept the emergency services vehicles able to get access, but not for public use. So this is a good example of where resilience partnership, working in business hours, was able to meet and basically resolve the issue. So I'll give us a couple of examples that have happened more locally. So the first one I'll give is an incident that happened in the Invergordon area, where an unexploded World War II ordnance was discovered at a location in the centre of Invergordon. Some of you may be aware of the incident. It certainly got a lot of media attention. So that ordnance was basically in between two schools. It was in between a secondary school and a primary school. It was right next to the railway line, and it was right next to the main junction in Invergordon. Caused significant problems in terms of schools having to be closed, ensuring there's care arrangements for necessary for the children, but also care for people who were evacuated. We had to evacuate a significant area of Invergordon. Care for people plans kicked in, and the local hospital opened up to receive people who had nowhere to go. That partnership basically kept going for a number of hours, from about 5 in the morning through to 2 in the afternoon, when the army were able to come in and deal with the unexploded device. So that's an example where we've had significant disruption to community, and as partner agency we've come together and we've got been able to resolve all issues fairly timelessly. One that's more specific to Sutherland is the snowstorms earlier in the winter just gone. So we ran an ELG meeting over a period of 3 days where we responded to numerous incidences where the various partners were having challenges. You know, a perfect example was somebody who was receiving palliative care in Bay Hill, but the nurses, district nurses couldn't get in. Their vehicle wasn't suitable to get in. So through the multi-agency meeting, we were able to identify 4x4 support to ensure that they could get to that patient to continue care. We probably had best part of a dozen incidents similar to that throughout the area over the 3 days. And the most significant incident was when the Ord of Caithness closed, and there was upwards of 30 vehicles stuck on the Ord of Caithness. Obviously, we had to have a multi-agency response to recover the drivers, to clear the road, but also care for people arrangements in Helmsdale where people were queuing up, unable to go northbound, and also being evacuated out of the closed road section of the yard. So that's probably more localized examples of where it's been used. Really, the idea is to make community partnerships aware that this resilience partnerships exist, and also that we will respond to things in your community. And I know that some communities are looking at their own localized resilience plans as well. So that's all as a quick oversight of the ELG. What I'll do is I will stop sharing my screen. I'll take any questions if anybody has any. Councillor Baird.
Thank you, Richard, for that input. And I take you back to an event of March the 29th, when there was a missing person from Lairg, and there was a huge involvement of services over the Friday, the Saturday, the Sunday, and the Monday, involving the Coast Guard and everything. Now, there was a number of volunteers called on Facebook to come and help. We approached whoever was there at the police or the Coast Guarding to see if there was any help we could do in the searching for this missing person. And basically, we got the brush off that you didn't want our involvement here at all, which we felt was a little bit, you know, when there was great concerns that this chap, you know, could be, well, literally anywhere. And I mean, there was huge searches, as you're probably aware, of the Shin River. They thought that he had gone in there. And lo and behold, at the end of the day, he turns up back at his house in Lairg.
Yeah. So in terms of that, the response to a missing person would be unlikely to come under an ELG meeting structure. So where we have a missing person and the community volunteer to assist, there's quite a lot of risk assessment goes into that, and it's coordinated by our police search advisor. So there's quite a lot of consideration as to whether it's actually safe to allow people to become involved in searching. I wasn't actually on that weekend, but I'm fully aware of the circumstances of that and the considerations that were given, and they were working on specific information in areas where we would not put community volunteers to search. And that purely comes down to the risk assessment. What we don't want is, we've got a missing person, we don't want to end up with anybody else being missing or injured, because that then diverts resources. So yeah, there is some examples where we have used community volunteers to great benefit, but there is occasions where we just risk assessment, we just can't allow it, or we can't support it. If people want to do it themselves, we can't stop them, but we can't support it on occasions.
Yeah. Okay. Thank you.
Any other questions? Okay. Thanks, everyone. Okay, we'll move on to item number 6, which is thematic group updates. And we'll come to Chair for the Employability Group, please.
Hello, good morning, everybody. Okay, can I just share a quick slide I've got with the... Yeah, can everybody see that? Yeah.
Yeah.
Okay, that's fine. Okay, this is just a quick statistics I printed off this morning, and it's from Stat Explorer, which is an online tool where we can download information from DWP statistics. So this is for Caithness and Sutherland, so I've highlighted the ones in green which relate to Sutherland. So this is just to give you an idea of unemployment figures and those that are potentially looking for work in the future. So we can see searching for work. If we scroll down, Dornoch currently has 36 people, Lairg, Rogart, Lairg looked quite high, but actually if you think Lairg has actually got quite a large postcode, so it covers quite a big area, you know. Berriedale has got 0. We have to be careful with the ones that are 0, because if there's less than 6 people that the figures relate to, for confidentiality reasons, that will always put them down to 0, so that, you know, people can't figure out who they are. Brora 32, Goldsby 13, Cambrai 0, Forsyth 0. So on the whole, we've got a total of 144 people within Sutherland looking for work. Working with requirements, that is people that are potentially in work but perhaps working less than 16 hours a week. So they have to have some activity with the work coach to try and increase the earnings in some way or other. So I won't go through all the figures, but what I can do is I can pass that over to you afterwards, just to give you an idea. Those with no work requirements, so those that possibly have ill health, have got disabilities, or maybe a carer for a member of the family, or perhaps got young children under school age, which obviously restricts them from going back to work. Those planning for work are those that are potentially looking to go back to work in the future. So it may be that they're recovering from an illness, in which case they would have to work with a work coach to put steps in, you know, to start looking for work in the future, or maybe looking at making up a CV, things like that. Preparing for work would be those that are looking for work potentially in the near future. So working with a work coach on a fortnightly basis or a weekly basis. So that is the figures for that. Has anybody got any questions on that they would like further information on before I move on? So I can pass that on afterwards. Okay, just really other things that we've been working on is the childminders, and just to give you a quick update on the information that we've got back from the Scottish Childminding Association. For those of you who don't know, the employability team has been working very closely with the Childminding Association over the last 18 months, where we have provided funding to try and recruit new childminders in the area. We've had quite disappointing results really, but quite understandable. I'll just go through those results quickly. So over the last 18 months, we've managed to get 2 people registered as childminder over Caithness and Sutherland, one in Thurso, one in Lairg. So the one in Thurso, unfortunately, has just gone on maternity leave, so she won't be running her business until the end of the year. We've got another lady who's in Lairg, and she is working part-time at the moment. She's currently got 2 children in her care, and she's hoping to increase their hours up to 4 days a week. So that is quite good. We've got another 3 candidates which are progressing through the childminding programme, 2 in Thurso and 1 in Wick. And we also had 2 in Sutherland, 1 in Dornoch and 1 in Brora, but they've unfortunately pulled out of the programme for personal reasons. We don't actually get to find out what the reasons are, which I feel is one of the disadvantages, because I feel like we could have because of GDPR, the Scottish Hardmen Association won't let us know who the people are. But I feel if the people on the ground, like ourselves or the ELC Commissioner, could work with these people, maybe there are some issues that we could overcome that could keep them going on that track. The SCMA have been awarded over £1 million from the Scottish Government to step up their recruitment in Scotland to recruit over up to 1,000 new childminders. So the the Scottish Childminder Association have been given over £1 million. £900,000 of that has been given to the SCMA to deliver that programme, and just over £200,000 of that has been set aside as start-up costs for the any new candidates, that come forward. I feel that equity could have been better balanced, maybe more money put towards the start-up cost to be a more attractive incentive for them to come on board. As we know, in Caithness and Sutherland being a rural area, it is very difficult to make it a viable business, because some of the kids might be few and far between in rural locations. So we are looking at see how we can get more flexible models of childcare in the area. I was speaking to the economic advisor for the Highland Council. The Highland Council has been successful in its bid for the ADAP fund, which is the Addressing Depopulation Fund, where 3 local authorities in Scotland have been awarded a share of £180,000. So the Highland Council is looking at feasibility. They will use that funding to look at feasibility studies in North West Sutherland to see how we can look at different models of childcare. So I'm hoping to be linked in with that to see, how that works out over the next few months and whether that can be rolled out in other areas as well. So that's really good news to hear. You may have heard also that Kinlochbervie and Melvick Nursery will be reopening in August this year, which is really good news for parents. The recruitment is underway for 2 new early years practitioners to staff the Melvick Nursery setting. There is currently a vacancy in Kinlochbervie for a part-time early years practitioner. The post closes on Monday, so I'm hoping that it will be shared widely with everybody and make everybody know about it so we can get the place staffed ready for reopening in August. So that's really good news. The only other thing I really wanted to mention was the Transport for Tongue. I'm not sure whether anybody knows whether it's still going to be going ahead or has there been problems with funding. I don't know if that's something that we need to look at. I don't know, can anybody answer that question for me? Yeah. Michael?
Yes, Fiona. Richard is still working ahead on this one. We have had a knockback from Scottish and Southern Energies input to their side of things, but that's principally because we haven't been established as being an up and running outfit yet. But I think when we do get moving forward in a small scale, they will come back and probably then put funding into the scheme. So that's all I can kind of update you at the moment, but things are moving forward.
Okay, thank you. Because I think Farr High School had been speaking to me about they were quite concerned about students getting to college, being able to go to work experience, and yeah, so they asked me to put the question. Yes, David.
Yeah, just to point out that you asked specifically about Transport for Tongue, and Councillor Baird wasn't speaking about Transport for Tongue, he was speaking about the Sutherland-wide thing, which doesn't include Transport for Tongue. It's a very separate thing. I think Marion will be able to inform you better about the tongue aspect.
Yeah, I'm one of the directors in Transport for Tongue. We do fully intend to provide the college transport again for the following academic year. We realise how essential it is for our community, so one way or another, I'm sure we will be able to provide.
Okay, that's good news.
Okay, thanks. Is that your update, Fiona?
Yeah, that's fine. Thank
Perfect.
you.
Does anybody have any questions for Fiona or any points they want to make regarding that? Marion, your hand's up. Is that just previous hand? Okay. We'll move on to the food and fuel poverty. Jim, is it?
That's my one, Richard. Yes,
Yep.
indeed. And just at the welcome the words from the last speaker at the opening of a nursery in Kinlochbervie. That's tremendous news. But there's never ever good news everywhere because we're fighting to keep the nursery open in Glenfield. So it's one up and one down is the way of the world at the moment. As regards the food situation, I think we're in a fairly a plateau at the moment. I would say at the food support necessary is met with charitable groups like CFINE and community efforts, and what the KOSDT are doing with Cash for Kids and things like that. And we have no resources as such to actually support from the local authority side at this moment. The emphasis we're turning towards is community food growing. And I have an outstanding meeting to take place with Anna to try to follow up with some of her ideas on this. And we're already moving into the growing season at the moment. But I did highlight in my report the fact that nothing comes easily and that there are costs involved in everything, even though there's volunteer labor, and that any project of any community project of any size will require perhaps to look at the resources that they can get, because physical effort is one thing, but it's always better having mechanical tools. And things like polytunnels are wonderful, and perhaps we should have more of these. So we're just a change of emphasis moving towards community food growing is where this group is going. As regards fuel, we have had a season with the Fuel Poverty Advisory Panel working, Di Alexander working with the Ofgem board. We have also the Ministerial Working Group and getting nothing much back from that, and also the Human Rights Group. So we have had communication with these groups, but that communication is rather petered out at the moment, and we're just wondering, we have to kind of try and re-establish connection to see just what's actually happening. So again, I think in both groups, perhaps due to my inadequacies, things are perhaps just reaching a plateau, and we're looking to sort of see where we can go next. So that's where things are at the moment.
No, that's good update, Jim. Thanks for that. And we'll go to David next, please.
Just to add to what Jim's always a little bit undersells his role in this. So just to add to, as I'm working both the groups. From the food poverty perspective, just one project that was Sutherland-wide for the last year was that we worked with Argyll Game and the Country Food Trust on getting over 3,000 venison meals, highly nutritious venison meals that were delivered to us free for distribution at a value of over £18,000, and Argyll Game's contribution of the venison alone was over £2,000, and that came to the larder for distribution right across Sutherland. And it had a best before date on it of the 31st of May, and the last packets went out on the 31st of May. So we managed the 3,000 packets well across Sutherland for the entire year. I think most people enjoyed them. I think it was very difficult in Sutherland having so many that I think some people had them a few times, but we will look to work with them again because it helps to get healthy meat into and nutritious food into the food support system, because often with the best will in the world from FareShare, a lot of the food that we get delivered through CFINE is not the most healthy or nutritious. That doesn't mean it's not appreciated, but if we can do anything to make meals more healthy, more nutritious and more local, which is important from a climate perspective, then that was good. So that was an excellent project, and we'll look to see if we can do that. I had Rory from Argyll Game in here the other day speaking about how we can do something similar in the future. So that is really important. And the other thing that Jim kind of undersold there was the fact that myself and Di Alexander, I did note in minutes his name was spelled D-I-E, which is a bit unfortunate. It's D-I. I think D-I-E is a bit of a bad omen. But myself and Di were invited by Gillian Martin, who's the Minister for Energy, because of our contribution in previous work groups, to meet with Ofgem for a briefing session for the call for input on affordability and debt. We did that on the 1st of May, and myself and Di both put forward the situation in Sutherland and the injustice of energy pricing that is driven by Ofgem, and really made sure that that was minuted. And we got real support from the Energy Minister and from many of the national bodies that were on that meeting as there as well. So the work that goes on at these groups that Jim shares is getting national recognition, and Sutherland is on the map as a result of these groups. So I just wanted to make Jim undersells his role a bit there, but they're doing a fantastic job. That's all I really wanted to say at the moment.
No, that's great, David. And yeah, I'd echo you say Jim does do a great job in both that groups. So comments are noted. Anybody got any other questions in terms of food and fuel poverty? No. That then takes us on to housing and infrastructure. Maria.
That's me, thank you. The focuses of the group are much the same as they were before, but we're probably slightly more focused on the retrofit, trying to bring housing back into stock that has been long-term empty, perhaps, not just housing property, but other properties as well. We've been looking at all models of homes for Sutherland ownership, long-term lets, crofts, woodland crofts, key worker housing, and trying, as I said, to identify properties with potential to be brought back into housing stock, retrofit options, collaboration with owners of inefficient properties of all sorts, and supporting the ongoing projects for housing that are in Sutherland, which there are many of, we've spoken about before. We had a great learning opportunity when Lochbroom and Ullapool Community Trust came and presented about a funding application they're working on with Changeworks. They've been doing this since 2023. It's a transformative project looking at having homes correctly assessed for retrofit with regard to heating systems, and it focuses largely on the regulation of put in place by the structure of past 2030 qualifications and compliance, which is to do with correct assessment. Lots of properties have been incorrectly assessed with different kinds of installation regarding heating. And I'm trying to remember what PASS stands for. I think it's publicly available specifications, I think, and it's to do with training. And we saw it in the group as perhaps an opportunity to support individuals and small businesses to upskill and add to what they can offer to communities, particularly around the area of Ullapool and Lochbroom, where this project is going on, should the funding come through. Perhaps a good use of community benefit in some areas. Other things, Kyle of Sutherland have shared initial information from their crofting opportunities questionnaire and the work around that. Else, I think Communities Housing Trust have also got a pilot study going on, which is to do with crofting, woodland crofts in particular. We're looking forward to our next meeting of the subgroup, welcoming the Empty Homes Officer from Highland Council, who's had their role reshaped to be more focused on rural communities, and it's focused on bringing long-term empty properties back into use as homes. So we'll hopefully at that meeting find out how the Sutherland group can work with the Empty Homes Service, because the officer has been given a focus of Sutherland as an area to work with in particular. I don't know if David maybe wants to add to that from a steering group point of view or from the crofting opportunities, but that's me for now. Thank you.
Hi, thanks, Marion. Richard, is it okay if I come in and speak about crofting? We, through the membership of the Homes Group, that again very ably chaired by Marianne, we decided we're speaking to a significant landowner in Sutherland, Easter Ross, who's got potential for creating new crofts. So we wanted to gather some information which is useful right across Sutherland from an SCP perspective, and for potential landowners to create new crofts. And this all stems from the basis that we want younger people to be able to live and work in the area, and creating crofts is a way to do that. And I think I've also spoken to Gary Campbell, the Chief Executive of the Crofting Commission, about the modern trends for smaller crofts, etc., etc. So we're going to look at that. Anyway, we had a 3-week period where we looked for responses, and in that 3 weeks we got 99 responses. There's a few that are partners in the same household, so we'll have to look at that. But there's certainly over 90 responses in 3 weeks, which is far good. We thought if we could get 50 responses, that would be excellent. Just a few headlines, because myself and Fiona are going to work at getting a proper presentation done with this, because we've got some nice pie charts and everything. But just a few headlines from it. The area where people would want to have a croft if they could get one. That was a multiple option, so it doesn't correlate directly with the 99. There's more than that, but it's actually quite an even spread. As you would expect, the most came from East Sutherland with 66, but then Central Sutherland 55, Easter Ross 55, West Sutherland 51, and North Sutherland 49. So a fairly even spread there. Some of the people who were applying were coming from far-flung places like Birmingham and Ireland and Caithness and places like that. The split of male-female was 54% male, 46% female, which is fairly traditional now. It's actually usually about 50-50. The really interesting thing that I'm seeing coming out of this is the age group. And 55% of the respondees were between 22 and 40, which is excellent. And then another 38% between 41 and 60. So 95% of the respondents were under 60. So that to me is a really good indicator of when we're looking at repopulation of areas with younger people. So that's fantastic. Only 12% of the respondents were looking for the croft as a lifestyle choice. Most of them were looking at to add to their way of living. So that again shows it's economically active people. 56% were looking for tenancy and 44% for ownership, which is quite interesting. Another really interesting thing is nearly 50% of the responders were willing to pay a much higher rent than traditionally you see on older crofts. So 50% were prepared to pay between £500 and £2,500 a year rent. And I know that there's complex formulas about what you can charge, but that's quite interesting if you're trying to entice landowners to create new crofts, because traditionally crofts you might get £100 a year, but if you realise you can create crofts and make more income, that might mean that land that's used for other things is made available. And only 24% were looking for land without either a house or a site. So that shows to me that people are wanting to live and work, and it's younger people. So I think that's really, really encouraging. As I say, I've got a meeting with landowner on Monday. We'll disseminate this and we'll get a presentation at some point. We'll be able to do a proper presentation, first of all, to the Homes Group and then see where we go. But the reality is that this will only matter if we can create new crofts. And my meeting on Monday is crucial, because there is the opportunity potentially to create 4 new crofts quite quickly. I mean, quickly in the scheme of crofting law. So, but that has got to be there. We can't keep going and asking people for what they want from homes and then not delivering for them, or not delivering sites for them. So we have to make sure that happens. But I thought it was interesting just to get those statistics across.
Guys, it's a really good update, David. Thank you for that. Obviously, has anybody got any questions for Marianne or David in terms of that? No hands up. So we move on to Sutherland Cares.
Yep, I'm going to give the update for Sutherland
Perfect.
Cares. So Sutherland Cares is quite a new group. We've had 2 meetings. It is open to anybody in Sutherland or externally who has an interest in mental health and supporting improvements in mental health in the Sutherland area. So anybody would like to come along, they just get in touch with me and I'll make sure that you get invited along. We work quite closely with the whole family wellbeing team that are based through Highland Council and are tied in with a partnership. And we've been working quite closely with Planet Youth, who have sort of programs running at Dornoch and Golspie High School, and we've been helping them develop their action plans following the results of their S4 surveys. Most recently, we had a meeting this week and we had an input from COOTH, who provide mental health support to young people in Highland up to the age of 19. And they had some really interesting statistics. I mean, hard reading, but just this, like the stats from Highland about what the young people are contacting them about, which kind of tied in with quite what some of the stats that were coming out of the High Life Highland surveys in our local high schools. So that was interesting. So work to be done there. Worked quite closely too with the health improvement team and Ailsa to deliver 2 green health workshops in Lairg, looking at how we can make the most of our green spaces and our blue spaces in Sutherland, to promote sort of health opportunities and that sort of getting back into nature and the benefits of sort of social prescribing, before people need sort of proper mental health medication to try and be a first step. So we're going to be taking that a little bit further too. Also had a little bit of an input from the whole family wellbeing team about the funding that they're going to have available shortly. I think Hayley's on the call, so she can keep me right, but working with Highland Third Sector Interface to deliver that, and I think it's going to be nearer September time where that becomes available. Yeah, I think that's me.
That's great. Thank you for that. Fiona, does anybody have any questions about Sutherland Cares? No. That then takes us on to transport. So I'll hand over to Richard for that.
Thanks, Richard. Yeah, we had a meeting of the transport subgroup a couple of weeks back, and we're not making much progress within that forum, to be honest with you. The local community group, transport groups that already exist are doing a fantastic job. Transport for Tongue and Go Golspie, all these guys, they're doing a wonderful job with what they're doing in their own local areas, which is fantastic. But we did come up with a bit of a stopper, and it might be interesting if Fiona might want to comment on that, Fiona Thompson. The patient transport, we had a representative from the patient transport Scottish Ambulance Service at the meeting, and more or less just said that there is no patient transport unless there's a clinical need, and the clinical need it needs to be defined. And then, the transport service, this patient transport service won't tell us what the definition of clinical need is. And what they're saying is that if we tell everybody what the clinical need is, then everybody will want it. So it's a closely guarded secret, and they're not going to tell anybody what it is. But generally speaking, if you phone up and ask for patient transport, the general rule of thumb is they ask you if you can walk to a car. If you can walk to a car, you can't get patient transport. So that's the rather sad fact of the matter. So that's one of the things we're trying to look at with the establishment of the Southern Resilience Initiative, which now we have there's a company limit to a guarantee, and we've had a completed integrated transport plan created by Urban Foresight, and I'll try and share a snapshot of it with you if I can get this sharing to work. I'm not an expert at this, but I'll give it a go. Let's see what we've got here. Nope. No, I'm fairly miserable at this, so I'm going to stop doing that. I'll just give you a rerun of it myself here. There we go. So that's what I'll do is I'll share this plan via Fiona Keller Sullivan, and she can pass it out to anybody that wants it. So the transport network has been based on what we need is an integrated service to improve the utilisation of existing assets, reduce under-servicing and duplicated cost. We want a combined service to support socially isolated individuals who experience barriers to transport that compound economic, social, educational and health issues. We need an organisation, which is the SRI, created of established partners to facilitate frequent cross-organisation communications to improve the reliability and frequency of the public transport service for Sutherland residents. And that's what we're looking at, is basically trying to get this service up and running. Now, as Michael, Councillor Beard mentioned earlier on, we did get a bit of a knockback in terms of funding. We have enough funding to launch on a very small scale, and we're looking at the best model to do that at the moment. But we will have something running within the next 2 or 3 months. But it's just a case of how we actually launch it, and then we'll build from there. But of course, the main issue with the SRI, Southern Resilience Initiative, is not just to be a transport group, but also to be a much more representative group for Sutherland as a whole. Because at the moment, we all know that Sutherland is extremely unrepresented as a county, and we don't have anybody really promoting us in terms of taking advantage of the green freeport opportunities that we have. And of course, transport fits into that so well. And on that basis, I'm meeting with the High next week to have a discussion about how we can take this forward. So the transport is just one part of the issue, but to me, it's a catalyst for everything else. If we can get people moving around to education, to employment, to health services across the county, that makes it a much more equitable society. And then we can look at the other bigger pictures as we go forward with that. So that's where we are at the moment. And as I say, I'll share that plan with anybody that wants it. Thanks.
It's great. Thanks, Richard. Good update there, and a lot of work ongoing. Does anybody have any questions for Richard regarding transport? No? Okay, we'll move on to the next one, which is network group updates, starting with Phil Tomlin for Northwest 2045.
Morning, everybody. I have circulated an update, so I won't read it out. I'll just quickly skip through the main points. And I also note that Marianne is on the call and Boyd, so they may want to add something. Boyd Alexander, they may want to add something afterwards. The first thing is CRF funding, which has been awarded. That is enabling us to review and refresh the Northwest 2045 vision, and we will engage with the full partnership on that when we get on with that. Delighted to announce that the Regional Land Use Partnership has been extended for 3 years. That's a Scottish Government pilot to try and get communities and landowners working together. The aims and objectives, I've put those in the thing that will be circulated in the update. Sorry. I suppose the key bit for us is that the starting point is going to be the Scottish Government strategy, so we're waiting for that to come out. Just some more local stuff, and building on the Land Plus work that Sarah Harkins has been doing. Her and Boyd are working on a Kinloch Berby local place plan. There is also the repopulation work that Boyd is leading. There's some stats on housing projects that have been taken forward there in the update. I think probably the childcare success, excellent news that the ELCs will open in Ecclesbui, KLB and Melvick has already been covered, but Marianne may want to add something to that. And I think that's probably all that I will say just for the moment. There's plenty of detail in the update, and you can always get in touch with me if you'd like to find out more. Thank you.
Thanks. I'll open it up for anybody else who wants to make any comment or any questions regarding that update. No, nobody. It's fine. We'll move on then to Sutherland Community Anchor Network with Angela Simpson.
Both Angela and Karina have put in apologies, but I do have a written update.
Thanks,
so Sutherland Community Anchor Network continues to meet on a monthly basis. It's recently changed its name from the Sutherland Resilience Group to stop any confusion around resilience. It's made up of anchor organisations and community groups from across Sutherland. It includes updates from each of the anchor organisations attending on current projects, challenges faced, information sharing and identifying partnership opportunities. They have recently had new representatives join the group from Dornoch, Kinloch Berby and Durness. The next meeting for the group will take place on Wednesday the 26th of June at 10:30, and we'll be joined by John Sturrock Casey to discuss building capacity in our local communities and how groups within our communities can work better together. That was from Karina.
Good, thank you. Is anybody got any comments to make on that or any questions? No, that takes us on to the Sutherland Community Partnership Project. So over to yourself, David.
No bother, Richard. And actually, item 8, which is about the SCP, actually ties into this. So I'll cover that as well, and then we can go on to 9 after Dan. So I suppose the good news is, since the last meeting, we've had acceptance that we were successful with funding from the UK Shared Prosperity Fund for the team going forward. And that is match fund by Highlands and Islands Enterprise, which means that we have the continued resource of Scott and another person until the end of March next year. So that's good that we've got continuation of that, and there still is a good resource. Obviously, Fiona's still kind of covering at the moment because we have a new staff member starting on Monday. And obviously that's it to work with Scott. We went through a recruitment exercise. We had 2 really good interviews. Myself and Fiona interviewed. We had 2 really good interviews, but we knew both of the candidates could have easily done the job. But we have an outstanding candidate, and Miranda Jones, who lives in Lairg, lived in Lairg for the last 2 years, is going to be starting with us on Monday. She's currently working with Lairg Community Council as the secretary, has volunteered for LDCI, but her previous career in England when she was there was as a Green Party councillor in Rutland County and as a town mayor. So Jim, she'll be keeping you on your toes, no bother. And yeah, she really passionate about it, really wanting to do the job. I think she'll be an excellent asset. And so Miranda starts on Monday. She couldn't start this week because she's at Taylor Swift for 2 days, so lucky her. So that's as far as we are with the team going forward, and the support for the SCP. We have that until March. Clearly, in a few months, we'll be saying, well, what happens after March? So we have to continue to have these conversations. And my personal opinion, as the manager of KSDT, not as SCP, is that we should be ring fencing some of the coastal communities funding for the SCP, because it really impacts on every community in Sutherland. I can't think of a better way to use it. But anyway, that's by the by. So the next item on the agenda is about the reaffirming commitment to partner sport team funding. As I said, we got funding from the UK Shared Prosperity Fund, but one of the conditions that we have to satisfy them with is a bit awkward, because one of the questions was, is this a partnership? So you tick the box, yes, and then they come back and say, can we have a signed copy of your partnership agreement? And we don't have a partnership agreement because it's a statutory requirement. So what Fiona has done is drafted a letter. Previously, Ian McClellan had to write something for a funding bid. Fiona's drafted a letter that will pass to the chair, and hopefully an agreement that it will get signed, just to show that there is ongoing support, that this is a partnership, and that there is support for working with the external team to help promote Sutherland. Fiona's done a good job with that. We'll get Richard to sign that, hopefully. And I think what we just want minuted on here, that there is, this is a partnership that supports the staff team going forward for the next year. So if we can get that minuted and get the letter signed, then I think that ticks the box of what we need to be able to access the funding. The council staff members do understand that this is a statutory requirement, so it's actually the legislation that is in essence the partnership agreement. But I think it's good to have something from the local members to show that this is supported. So we'll just get that sorted. So that's me kind of covered everything there in 7 and 8, Richard.
Yeah, so I'm sure it'll be minute the support for you, and I've got a copy of the letter. I've skimmed through it just shortly before this meeting. I'll read it in more detail, and I'll get a signed copy back to you. So should have that by the end of today. Has anybody got any questions for David on either of that points, or any points you want to make? No. Okay, that takes us on to agenda item number 9, which is community matters and EOCB. So open up the floor for anybody who wishes to raise anything. Okay, Marianne.
I was trying to get my hand up at the end of Phil's bit about the Northwest 2045 and I couldn't get it to go up, so it'll come now. It was just a little bit more about the early learning and childcare situation and the fact Phil and Fiona both mentioned the good news about the funding for the Addressing Depopulation, specifically to do with early learning and childcare. And it just gives us the scope to look into things like a rural childcare practitioner model, dual qualification of people to make jobs more viable in the small communities with regard to early learning and childcare, but also social care. So it's all, as we know, all these things tie in with each other all the time. So that's, you know, that work will be sort of going, we're ready to go and start thinking what's the best way to spend that funding. And it's a 2-year allocation. So, you know, there'll be more information coming about that. I know there is concern now about another nursery closure, or not closure, mothballing in Sutherland. But it was just to say that, as we've already heard today, we've had 3 early learning centres in the Northwest 2045 area reopening in August because there's been a lot of work done. The situation has changed slightly. The officers in the education service really did take everything on board, and these places are set to open. And not just that, that there's consideration given to extending what they offer down to 2-year-olds, not just the statutory 3- and 4-year-old provision. So it's really positive, and members are meeting with the head of service for early learning and childcare on Monday at the area business meeting, just to discuss it and to make sure that the mothballing situation is a consultation period. And that really was how it worked on the North and West with the 3 that we've mentioned. So it's, you know, it's a blow to any community, but I think we just need to work with what we have, and we had a positive result there. There's no reason why that can't happen again. So hopefully we can see that happen for the next nursery as well. I think the figures are looking good there as well. The school rolls are going up, so there's no reason at all why we shouldn't have that reopening, given the current circumstances next year, or next session. Thank you.
No, that's great. Thank you for that. Next, David.
I just an AOB from another one of my roles. So I sit on the local executive board for MFR Cash for Kids for North of Scotland, which covers Highland and Moray. So it's a big area, and we had our one of our, I think we have 3 meetings a year, so that's the middle one this year, and we approved over £60,000 of support for people across Highland and Moray, which was fantastic. But the 2 bits of news that are relevant to Sutherland, one is that when we were down in Elgin for the meeting, we met Mandy Beard, who does the Cash for Kids hands-on art sessions down there in Moray, and there is also another artist in Inverness who does that, and it's basically given the opportunity for schools to put kids into for an hour into a completely different atmosphere and using art to help with some of the challenges that they're facing, and it's proved to be incredibly successful in Moray and in Inverness. And Lindsay, the manager of MFR Cash for Kids, is really keen to see if we could replicate that in Sutherland. Now, a lot of it depends on the person, and I know it's really important, and meeting Mandy down there is really important to get somebody who is really good at engaging and is an artist. But if you can think of anybody that potentially might be interested in working with kids from an art perspective, and it's not quite art therapy, but it's certainly we could show clear evidence from the schools in Moray of the benefits that some of the youngsters are getting from that, particularly primary school children, that there could be a benefit there. So if anybody is aware of anybody in Sutherland who may be interested in speaking about the opportunity for being supported by MFR Cash for Kids to deliver a Sutherland a hands-on art project, then please get in touch. So that's one thing. And the second one is that very, very shortly, MFR Cash for Kids will be recruiting for a corporate fundraising executive. It's a full-time and permanent position, but it is able to be worked from remotely. So it's anybody in Sutherland could apply. So it's a good opportunity potentially coming up, and I'll make sure that that gets shared through the SCP socials and everything like that. But that potentially could be another good opportunity to help in a sector that I think we're all really passionate about. So that was just the two MFR Cash for Kids AOCBs from me.
That's really interesting updates. Thanks, David. And I encourage anybody to contact David if they can think of where that could be used in Sutherland. We'll move on to Fiona.
Yeah, it was just something that had come up with the apologies. A few people saying that Friday meetings were just never ever going to work with them always being on a Friday, and if there was a possibility of having the full partnership meeting change its day every so often so that other people could attend. I know Fridays, I think, work best with Highland Council's meeting dates, with my understanding of why it's always on a Friday, but I just thought I would raise the point, seeing as we'd had a few messages about it.
Seems a relevant point. If that's an obstacle to people attending, then yeah, probably look at that going forward and not always having it on a Friday. It is just maybe convenient for some, but if it's not for others, then we need to look at what we do there. So we'll be able to take that going forward, Fiona. Thank you. Hey, Phil.
There is a calendar of all the meetings for the year that's issued by the council in December, the year before the year starts. So if it's a case of picking away through that and finding dates that aren't free, that information is there, and I can put you in touch with that, Fiona, if that would help.
Excellent, thanks, Phil. Steffi Campbell.
Sorry, you're not getting Steffi. She's gone AWOL. You're getting Denise.
Okay.
I would just like to say, from Tykes Young Carers' point of view, we've been working in the background for a number of years now on getting young carers statements recognised in Highland. It's a part of legislation that young carers have a plan set out for them. There's all their criteria is met. It's discussed through with them what they would make their lives a bit better. Highland is the only place in Scotland that haven't rolled it out. In the last week, it went to committee and it's been approved now. Education are going to take it on board, which is brilliant because at least the young carers are going to get to have their voice recognised now. But where that lies comfortably for young people to be carrying out their young carer statement with a school teacher or in the school environment might not be right. Richard updated us on that last week, and it looks like there'll be potential for the young carers projects in Highland to deliver that now. So we're hoping that maybe Highland Council might fund young carers projects to deliver such work, because it's not just a one page of paperwork, it's following through their actions that they request on it. But we've been working on with other young carers projects in Highland with that, and delighted now that we've pushed it through and it's looking a bit more promising for our young carers.
That's a good update. Thank you for that. Does anybody have any questions or points they want to raise in relation to that? No. So no other AOCB for anyone. Okay, it takes us on to agenda item 10, which is the day of the next meeting. So the next full meeting will be the 6th of September. Conscious that's probably a Friday, so I would suggest we stick with the one date that's in the diary just now, and then going forward look at new dates from then on, whether we move it from a Friday on occasions. But so for me, it's obviously just thank you for your time today, and unless anybody's got anything else, that's it, and I'll let you head off.
Thank you.
Thank you. Goodbye.
I just wanted to say thanks to Richard, because Richard, you're not going to be chairing the next meetings. I just wanted to thank you for chairing this meeting and for all the contribution that you've made, and hopefully Callum will prove to be as good a chair as yourself.
Callum starts on the 1st of July, so I'll make sure there's a good handover to him. I may do the introductions just after the start of July, and thanks for your comments, Steve.
Thank
Cheers
you.
now.
See you
Thank
later.
you.
Bye.
Thank you.
Bye.
Bye.